Hello and welcome to Learning the Art of Healing Primary Care Medicine, the podcast where we explore how to rediscover joy in patient care, embrace the meaningful moments in medicine, and stay inspired in our careers as healers. I'm Dr. Lisa Fulgenzi, your host and a primary care internal medicine pediatric physician. I've been practicing primary care medicine for over 30 years. In each episode, we'll dive into topics that help us nurture compassion, manage the challenges of our work, and stay grounded in the reasons we chose this path. Whether you're a medical student, a seasoned practitioner, or somewhere in between, this podcast is your companion on the journey to thriving in primary care. Let's begin today by talking about the patient encounter and how we can reclaim the joy and meaning in those moments. Well, when I did my training, this was at Wayne State University Detroit Medical Center. Dr. Howard Beckman and Dr. Richard Frankel had just completed a study in 1984 called The Effect of Physician Behavior on Collection of Data. And this study was done with the doctors at the medical center, and between July of 1980 and June of 1982. And the doctors were taped and seeing how long it took before they interrupted the patient. And it didn't take long before the patients were interrupted. And most of the time, the patients didn't get a chance to say all of the things that they wanted to. And then the doctor would just redirect them and go in different directions. And then sometimes the patient would bring up something at the end of the visit, and it would take longer to actually get through the other concerns. Other times, the patients just didn't get their other concerns handled. So we were taught, of course, I did my medical school training from 85 to 89, and then I was doing my residency from 89 to 93. So we were taught something called the agenda for the patient and the agenda for the doctor, and actually the agendas are kind of the same thing. And that's what we were taught to learn. And that if you just let the patient talk and you don't interrupt them, they'll tell you what they want to go over for the visit. And you just let them finish, or you say things like, and can you tell me more? And that must have been hard. Or open-ended statements like that so that they'll go on. And then you can go back and get details of whatever you think is important, because the patient didn't go to med school. Maybe they don't know what's important. That's one of the things that I thought was the most important that I wanted to talk about today. What's interesting is they did a follow-up study about 15 years later, soliciting the patient's agenda. Have we improved? And this was Dr. Beckman, Dr. Marvel, Dr. Epstein, and Dr. Flowers. And this was from 1999. It wasn't really much different when they had done the study. As far as the doctors interrupting the patient before the patient was done talking. I think the average time in the first study was like 16 seconds, and the average time in the second study was 23 seconds or something. If the patient was left to talk, the first study I think showed around 30 seconds or so for the patient to finish everything they wanted to say. So it was very interesting. And then there was another study that they did. This was, of course, after COVID. Dr. Frankel had done with Dr. Beckman, Won't You Be My Doctor, about seeing the doctor in a virtual world. And again, it talks about getting your questions answered, making sure you're still getting something out of the patient-doctor interaction, even though it might be virtual. And this was from 2020. So it's just very, very fascinating. So if you talk to the patient, and you ask them how they are and what their concerns are, and you just let them talk, it's actually less painful than if you try to keep interrupting the patient and redirect the conversation. You want to think about what's going on in the patient in front of you, and you want to just enjoy being with the patient. Even if you're tired that day, or the other patient made you tired, or whatever is going on, just try to enjoy being with that patient and enjoy the patient encounter. That's why you went into primary care. That's why you're there. The patient isn't there to waste your time. You're there to practice medicine. And you did all that study and all that work and all those hours of training to get to this point where you get to talk to a patient. Maybe you can't remember when you were first in college or med school and you hadn't really been able to talk to patients yet, or when you did, you were just there watching or you didn't quite know what to say. So you want to focus on connecting with the patient. Let them talk. So the focus of the podcast as we go forward are going to be just practical strategies for finding meaning and joy in just your daily encounters with each patient. Besides me giving you inspiring stories, I plan on having other doctors that I'll talk with and share their insights into how they've beat burnout and continued practicing medicine and enjoying the art of medicine and the art of healing. And other things, other tools and insights that might help you stay in the field of practicing medicine and avoiding burning out. But the main reason that I wanted to share this podcast is we went live with our electronic medical record August 31st, 2013. That's very abnormal that I exactly remember the day that we went live. The front desk was the 31st of August. The back staff, which included me, was September 1st. And it changed my life for the worse as far as sitting more and spending more hours online, just typing and typing and typing. I couldn't see as many patients per day as I used to. And it affected the doctors I was working with as well. It really affected how I interacted with the patient, and I had to really work on looking at the patient and not looking at the computer. It was really easy to get soured on the whole process of coding. I'm putting in all these codes. What am I doing? Am I just a expensive coder for the insurance company so they know what diseases their patients have? Well, I'd always been putting in codes. I just hadn't put them in. I would just dictate everything and someone else maybe had put codes in, or I'd put the codes in on a sheet of paper and someone else entered them on the computer. So that really didn't change, but my perception of what I was doing changed. What am I doing this for? Is this all I'm about? Just coding? And then just with the COVID virus, having to wear all this protective gear, I felt like it interfered with my interaction with the patient. And then going online and talking to people online, I thought interfered with my ability to interact with my patients. And so I really struck like a dark place in 2021. And I was like, wow, I just can't do this anymore. And it was that time that I just had to continue on. The other thing that inspired me to do this podcast was as I wanted to share my knowledge and my experience on a broader range, which the media allows me to do, instead of just teaching a student one-on-one or a resident one-on-one, which I've done before. I can share my insights on a video like this and multiple people can watch it. And you can watch it whenever you want. You don't have to be in my office while I'm teaching about a patient to listen to me. So teaching is the other focus, and sharing my insights on how to continue working and not lose hope and not lose faith in the reasons you chose this profession, and how you can still find joy in the practice of medicine through the encounter with the patient. Until next time, take care.